flying in the face of the global fight against HIV. The number of new HIV infections in Russia is soaring and more people are dying. But health workers say the government is failing to tackle a problem which is only getting worse. This is Inside Story. Hello and welcome to the programme in Doha. I'm Adrian Finnegan. The United Nations says that more than 1 million people in Russia are now living with HIV, the virus that leads to AIDS. Latest government figures say that 200 new cases are being recorded every single day. The main source of new infections is from dirty needles used to inject drugs. Russia has one of the worst heroin problems in the world, but it's resisted funding needle exchange programs, and that's angered health workers and global HIV prevention groups. Robin Forestier-Walker reports now from Moscow.
Natalia has a regular job. She never took drugs. She lives a regular life. She didn't know her former boyfriend used dirty needles to inject heroin. Now she's carrying HIV, the virus that causes AIDS.
Most people think that this problem doesn't concern them. They think that HIV is far removed from their reality, that drug addicts are second-class people. You can be HIV positive, you can look good, have a job even. But if your friends or colleagues find out, they may stop communicating with you.
Today, as many as 1.3 million people in the Russian Federation, that's around 1 in every 100 Russians, have HIV. And on average, some 200 new infections are being registered every day. Russia's AIDS research agency says the crisis isn't being taken seriously enough.
If we had 200 cases of diarrhea at a children's camp, the country's head sanitation doctor would fly out immediately to save them. It would be frightening. Governors would run, helicopters would fly, the police would search for the source of the infection, prosecutors would get to work. But here, we are seeing that there is a complete indifference to this situation.
While the government provides free medicine, agencies like the UN believe fewer than half of people eligible for treatment are getting it. Some choose not to take medication, others lack access or support. Sasha, who is herself HIV positive, runs an informal help and exchange program.
We see our friends which can't get in time the treatment because they have to wait for that, and we see the situation. Yes, the state is buying, but that's not a good thing that so much money is still spent on that.
In other words, activists believe government spending isn't value for money. At protests like this, they blame corruption and the pharmaceutical giants. If the cost of drugs comes down, the argument goes, budgets can be better spent on treatment, support and prevention. Ordinary women like Natalia now make up part of an extraordinary statistic. Over 40% of new infections are women.
What it shows is that far from being confined to certain groups, HIV will continue to spread with this infection rate into the general population.
Robin Forestier-Walker, Al Jazeera, Moscow.
Well, it's a worrying trend. Joining me to discuss the fight against HIV in Russia are my guests today. From Copenhagen, Dr. Jens Lundgren, who's co-founder of HIV in Europe, an initiative promoting early diagnosis and care of HIV. And from Norwich in the UK, Tony Barnett. Tony's a professor at the London School of Economics and Political Science, specialising in infectious diseases and HIV and AIDS. Dr. Lundgren, if we can start with you in Copenhagen. First of all, 200 new cases of HIV each day. Why does Russia have such a problem with HIV?
Well, HIV in Russia has been present in the last 15 years. So many people is infected already, which allows for further spread of the virus, especially in a environment where there is ample opportunity for further forward transmission. The two main routes of transmission in the Russian Republic is people who are sharing needles to inject drugs, as well as regular heterosexual sexual transmission. And it so happens that the management of people who is dependent on heroin is any management and care for these people are very poor, and therefore you have the ideal circumstances from the point of view of HIV for further spread of the virus, and the same, of course, goes for sexual contacts.
Okay, we'll come on to talk about the care of those who are HIV positive in just a moment. But first, in your opinion, what needs to be done in Russia to keep this rate of infection in check?
Well, I mean, this is not a unique situation. We have dealt with HIV throughout the world, and what needs to happen in Russia is what is happening pretty much everywhere in the world, namely that the policies and interventions that we do know to work to reduce transmission needs to be implemented effectively also within Russia to deal with this problem. So the solution is very simple. It's very evidence-based because we have a lot of experience from other regions of the world of how to handle both challenges, both the needle mediated transmission as well as the sexual transmission. But it requires that the knowledge and evidence that we have from other regions are actually used and implemented.
Okay, let's bring in Professor Barnett in Norwich. Tony, is there anything which characterizes the Russian HIV epidemic in particular that sets it apart from other areas of the world where HIV is prevalent? Africa, for instance?
Well, it's quite different from the situation in Africa because it is predominantly a intravenous drug user driven epidemic. The authorities in Russia have known for a very long time. They've been warned by their chief epidemiologist, Professor Pokorevsky, concerning the potential for this drug-driven epidemic to break out into the heterosexual population. And we're now beginning to see this. It's been warned against for the last 10 years at least. There is also other issues. If you look at the post-Soviet history of the Russian Federation, you see very, very uneven industrial development, you see the collapse of old industrial areas, and you see really a spread of hopelessness, which means that people have, in small rural communities, in old urban decaying communities, they have little else to do. And it's a major drug route through Russia from Afghanistan and that part of the world where the drugs are produced. So the drugs are available, they're used, and they're used very widely, using needles which are often recycled and shared. And in addition, there's little political will to facilitate harm reduction measures, which might be one of the conventional and tried and tested means for reducing the progress of this kind of epidemic.
Tony, I mean, this must be particularly frustrating for people like you and for Dr. Lundgren. Why do you think the crisis doesn't seem to be taken seriously enough by Russia's politicians? As one of the people we heard in our report a few moments ago said, that there's almost an air of indifference.
I have found that myself. I was interviewing politicians in the Duma about 5 years ago, and without any exception, however senior they were or however junior they were, their knowledge seemed to be relatively poor and their sympathies seemed to be extremely sparse. They have a very poor view of those who have HIV. It's a very stigmatizing condition in many societies, and that problem of stigma has certainly not been broached at all in the Russian Federation. So I think there's a general political unwillingness to engage with something which 70% of the population, according to a survey about 7 years ago, consider to be a highly stigmatizing condition. It's not politically popular. It doesn't sell votes.
Jens, do you want to add to that? We were trying to get a third voice to come on the program today, a voice out of Russia, and there was no one that would make themselves available for the program, and that sort of sums it all up, really, doesn't it? About the fact that it's not taken seriously enough. That the country seems to believe that internationally recognised approaches to slowing the infection rate, the ones that you and Tony were talking about, don't work. And yet it says it's doubled the amount that it spends on HIV prevention in 2012 compared to what it spent in 2010.
Well, I mean, the only thing you can say about an epidemic of HIV is that if you don't address it, it will only get worse because the routes of transmissions, as long as you don't interrupt those routes of transmissions, there will only be more and more people infected. I agree with the comment that the infection is enormously stigmatized. It is even criminalized, people who is infected with HIV. But all those feelings from a political angle makes absolutely no sense from a public health point of view, because if you ignore it, which we have ample experience for other places in the world. Look at South Africa. They ignored their HIV epidemic for quite a number of years. And the only thing that will come out of that, trying to ignore it, is that the number of people who's infected will just expand. So although the stigma, and this is not a popular political theme, the only thing you cannot do even as politician is to ignore it because it will only get worse, and that's exactly what is happening in Russia still. There's more and more people infected, and it will continue that way if nothing happens.
But Russia would say that it's not.
And you know, people continue to
carry on, Jens.
I just want to say, as long as people have sex with each other. In a population like the Russian, as long as people have sex with each other, there will continue to be spread of HIV, and it is just a human habit that you will continue to see happening, of course. So that's the basic point here.
Russia would say that it is tackling the problem. It's just not tackling it in the way that people such as you and Professor Barnett would argue is the correct method. It says that needle exchanges and heroin substitution doesn't work. They're wrong, are they?
Well, I could add something to that, if I may.
I can talk.
By all means, please, let's hear what Tony has to say first, and then we'll bat it back to you.
Well, I think there are two things to note here. Within the last 12 months, the federal drug authorities have actually closed down the Andrei Rilkov website, and I believe also the organization. This is a small NGO, non-governmental organization, which is actually concerned to educate people about harm reduction. And what they were doing was they were actually informing people that methadone substitution is a good idea because it is taken orally, this drug is taken orally, and it actually avoids the use of syringes. So the federal authorities cut that out of the public debate. It is also, I believe, the case that you can be arrested for actually owning a syringe. So harm reduction is not supported by the authorities in Russia, and therefore the tried and tested methods are not supported by the political class.
And Jens, what was the point that you were going to make?
My point was that I'm open for a discussion about other interventions to reduce transmission of HIV. I think we need to be open to that dialogue. But on the other hand, we also need to make sure that people can not only get away with claiming that everything, the approaches we are using everywhere else in the world is not working, and not come up with something that is working. And I think that's where we are at the moment, that the rhetoric here says that whatever we're doing in Western Europe and in Southeast Asia, where there's a good number of drug users, is not working. But what is the alternative? I don't hear that. I don't hear a serious discussion addressing that there is a problem, and also what is actually the public health plan and policy decisions that should be made to address this. I want to re-emphasize that there is an urgent need for making those health policy decisions by those who is responsible for public health in the Russian Republic, and that's really what we need to see happening, and not the opposite. Not that essentially, as was just mentioned from my colleague, that they're shutting down the very small attempts there has been to, for example, develop methadone clinics.
Well, new cases of HIV are being reported right across Russia. The Public Health Office says that more than 60,000 people tested positive for HIV in the first 10 months of 2012. And that was up 12.5% compared to the previous year. Nearly 2/3 of those who tested positive were male. The overall sickness rate was highest in the 30 to 40 age group. And more people in Russia are dying. The mortality rate in the same period grew by some 14%. Tony, what are the implications of ignoring, as Jens say, you can't just ignore the problem, but it seems that Russia is intent on doing so to a certain extent. What are the implications of not adequately dealing with an HIV epidemic on the wider population?
Well, there's one very key issue which we discovered looking at in a piece of research we did a few years ago at the London School of Economics. And that was looking at the ability of the Russian army and the Russian armed forces to recruit fit young men in the appropriate age groups. And in fact, so poor is the health of the Russian population in the age group that you would recruit into the military forces that they can't recruit enough people who are sufficiently well. And one of the factors in that level of illness is HIV. But in addition, there's the question of tuberculosis. One of the things that happens to people who have HIV disease is that they become sick with whatever infections are around. And one of the major infections which makes people sick is tuberculosis, some of it multi-drug resistant tuberculosis. So if you look at that particular age group which is recruited into the military forces and the difficulties of getting a sufficiently healthy young men and women to go into the military forces, and then you project that across the labor force in the Russian Federation and combine it with the fact that Russian population is actually falling, it's one of the few countries where population numbers are actually falling, then you have a major problem in the labor force.
So this is
now the question is whether
this is a ticking time bomb for Russia, really. It doesn't matter whether the people of that age grouping engage in risky behaviour, in that they share needles or engage in unprotected sex. There's a knock-on effect here on the general population.
Very substantial, and if you're educating people and they then become sick, then you're wasting those investments in education. On the other hand, of course, if you find that the people who are getting sick are in remote areas where there's no employment anyway, you might, if you're a very cynical politician, say, so what?
Jens, do people who are HIV positive have adequate access in Russia to antiretroviral drugs?
Well, I mean, the simple answer to that is no. The average HIV positive person in sub-Saharan Africa have better access to antiviral treatment than what is the case in the Russian Republic. So Eastern Europe is the region of the world, according to the latest UNAIDS report, the region of the world where access to antiviral treatment is the poorest. And that, of course, only compounds the problems around spread of tuberculosis, as was mentioned, which I certainly agree with. there's a huge public health problem on top of HIV by itself that really impairs the health of the younger population of Russia, and will do that for many, many years to come, in particular if nothing is done.
Is funding an issue here, Jens? Is Russia unable to afford the kind of care, the long-term care that people need once they become HIV positive?
Well, I'm a doctor, I'm not a finance person, so I will let the other address the financial situation. What I do know is, though, that the health infrastructure is well developed. There's many doctors, there's many nurses, there's many hospitals. So compared to, for example, sub-Saharan Africa, where there was very poor health infrastructure, the health infrastructure in Russia is available. That we have the right professionals. They're well educated. So everything is set up for really, having a much more proactive approach to this compared to, for example, sub-Saharan Africa. And one would argue that if you are able to provide antiviral treatment to very resource-constrained areas of the world, like Malawi, and is able to give a better care to HIV patients in that region of the world, one would hope that finances is not the limiting factor in Russia. But I'll let others speak to whether that is a real issue here or not.
Well,
I doubt it personally.
Okay, we'll put that to Tony in just a second. But first, let's just put this into context. In many parts of the world, the number of HIV and AIDS-related deaths is actually falling. The latest UN figures that we have show that 1.7 million people died from AIDS-related causes worldwide in 2011, but that was 24% fewer than in 2005. In the same period, the number of deaths in sub-Saharan Africa dropped by nearly a third and by almost half in the Caribbean. But two regions saw significant increases. The number of AIDS-related deaths went up by 17% in the Middle East and North Africa, and by more than 20% across Eastern Europe and Central Asia. Some parts, Tony, of Eastern Europe and Central Asia you could perhaps accept can't afford to spend a lot on HIV prevention and treatment, but that's not the case in Russia. It's a rich country, surely.
It is a rich country, and it does have a relatively good infrastructure, although the health system is uneven. It's a huge country, and there are areas where the health system is relatively poor, in part because medical personnel don't want to work in those areas, but also because those areas don't have the political clout to demand the services which they may require. With regard to the cost of treatment has fallen dramatically over the last 10 years. And of course, it's no longer based on hospitalisation. Increasingly, for example, in the UK and of course in Africa, treatment of people with HIV disease is done on a visit to clinic basis. People will take their medications, they have treatment buddies. There are all kinds of ways that we now know how to push forward successful treatment programs. Those are not being pursued in Russia, and I'm quite certain that it's a rich enough country to be able to do it if the political will were there.
And Jens, we'll give the final word to you on this as in your role as co-founder of HIV Europe. What would your message be to Russia's politicians right now? What needs to happen to change the mindset there?
What needs to happen is that we engage constructively in a dialogue. We are all Europeans. Everybody wants to help each other. We have been helping each other for the last 20 years to deal with this problem. And there is an enormous amount of people across Europe that is very, very willing and able to engage in a dialogue to rectify this problem. So please reach out. We are ready to engage. We are ready to help. We are ready to assist in any way that one could think of enough to address this and open that dialogue. We really need the dialogue. We need to understand what our experiences, what of those experiences can be used in Russia, which cannot, and if they cannot, why can't they be used in Russia? That all has to go through a dialogue.
All right. Gentlemen, I'm afraid we are out of time. Thank you to you both, Dr. Jens Lundgren in Copenhagen and Tony Barnett in Norwich in the UK. And thank you for being with us on this edition of Inside Story. Don't forget you can follow the discussion on the HIV crisis in Russia at our website. Go to aljazeera.com, follow the links for Inside Story, where you can watch this and other programmes again online. From me, Adrian Finnegan, thanks for watching. Bye for now.